Well, hello, everyone. We would like to welcome you to our Diabetes Prevention Program information session. We are so pleased with all of you that were able to join today. We will start off by letting you know that this Diabetes Prevention Program is actually supported by the CDC, the AMA, CMS. It's hosted here by Precision Healthcare, and our lead, who is certified, is Monitor My Health. So, welcome to our session today. So, just to give you a little introduction, my name is Vanessa Best. I am the CEO of Precision Healthcare Consultants, and we have the opportunity of working with several federal agencies, several state agencies throughout New York, also in the Florida area. And we are just thrilled beyond words to have this collaboration with Monitor My Health. Now, just to let you know who our speaker will be for today, we have the medical director and our presenter. It's Dr. Dana P. Wade, and he is the founder of Monitor My Health. And just to give you a little bit about Dr. Wade's background in terms of his education, from Yeshiva University. He is a fellow of Hispanic Community Health Study and Study of Latinos from the Albert Einstein College of Medicine, a fellow from the Division of Cardiology, from St. Matthew's University, Doctor of Medicine, from the University of Bridgeport. He's an MBA, and Dr. Wade brings over 8 years of experience in type 2 diabetes and cardiovascular disease prevention. He is a powerhouse. He is so committed to communities of color, Latino communities. He is so committed. There's been so many things that I've seen that Monitor My Health has done, even during the COVID pandemic, providing free services to the community, helping people learn how to really stay healthy through these difficult times. So he is a fearless leader and medical director with tons of experience and really doing amazing things for this program. And we're just so happy to really collaborate with Monitor My Health and make this program available. I know we've been speaking to a lot of assistant living facilities around the country, especially since this program is now remote. Employers, individuals, just about everybody. So it's going to be hard for Dr. Wade to make this for everyone that's watching, but I'm sure he will do an amazing job. So, with that said, Dr. Wade, we like to turn it over to you.
Yes, thank you very much, Miss Best, for the kind words. It's a privilege to collaborate with Precision Health. You are a leader and you are inspiring as well into the world of business. And thank you for the opportunity to bring this important service to the American people, especially during this time of the COVID-19. Uh, as you just said, I am Dr. Dana P. Wade. I am a medical doctor. I'm specialized in diabetes and heart disease prevention. I have been doing this for many years, and I am very blessed to continue to do this work because I am passionate about prevention. And prevention it's very rewarding to work into prevention because the results are very consistent and the results are tangible, both for patients and for healthcare provider, as well as for insurance payer. So diabetes represent today 32 million, affect 32 million of Americans, and there are 80 million Americans in the pipeline waiting to be diagnosed with type 2 diabetes. If we continue on that trend, uh, most of our healthcare resources would be um, directed towards managing type 2 diabetes, and that will also affect our workforce. So the Diabetes Prevention Program is an initiative from the CDC, Center for Disease Control and Prevention, with the collaboration of the American Medical Association and the Center for Medicare and Medicaid, that have come together to address the epidemic of diabetes. And thank God to the research base that have led us now to understand what we can do to curb the growing epidemic of type 2 diabetes in our country. So as I told you that this is a very important topic. Um, Before I continue, who are we? Monitor My Health is a 501c3 non-for-profit organization. Our mission is to prevent type 2 diabetes and heart disease. And how do we do this? Through screening and early lifestyle change. It's very important to understand that diabetes and heart disease in their preclinical stage do not have any symptoms. Therefore, there are many people walking out there and not knowing that they are at risk for type 2 diabetes and heart disease. And the knowledge, just the sole knowledge of this fact, give the patient or anyone the opportunity to do things that do not involve medication in most instances to reverse the disease process. So that is our mission. Our program is supervised by a medical doctor with more than 80 years of experience in type 2 diabetes and cardiovascular disease. So not only we have this research-based knowledge, but also we supplement it with some extra support from our medical doctor to help participants that are in the program. Our program has a full recognition by the CDC. What does that mean? It means that the program has achieved the highest standard according to the CDC criterias to provide the program in the community. It's a, it's a well-proven program. We have provided to more than 1,000 people, and we have successfully reversed type 2 diabetes in more than 75% of them. And even those who have not fully reversed it have also enjoyed other benefit. They feel better, they improve their sleep, and so on. So what is type 2 diabetes? So type 2 diabetes is a common health condition that causes blood sugar level to rise uh, above normal, and it is a leading cause of disability in America. What disability we're talking about is a leading cause of non-traumatic leg amputation, is a leading cause of blindness in America. It's also a very common cause for dialysis that stem from chronic kidney disease and um, other complications like heart attack and stroke. Diabetes increase the risk of heart attack by 4 and double the risk of strokes. So it has a lot of complications. But why don't you want to get diabetes? Well, diabetes first is an illness, and that means that we do not feel good. The quality of life is not what it is. So the quality of life is significantly decreased and is involved medications. And medication costs a lot of money. So that is the three main reasons why it's important. So talking about the cost, diabetes costs to payers almost $14,000 every year. This is the average medical expense incurred by those with type 2 diabetes. Now, compared to people without diabetes, those with diabetes have 100%, 100% likely to develop hypertension. That means that if I close my eyes and you put me in a room with 100 people who have type 2 diabetes, it's secure to say that all of them have hypertension. And 80% are likely to be hospitalized for heart attack. Half of those who have diabetes are likely to be hospitalized for a stroke, and up to 70% are likely to die from a heart attack or stroke. So now we have been doing this prevention in the community for a few years, and these are our results. And on the left, these are parameters that we look for. How do we know that that our program is effective and it works for people? Well, we follow the A1C, which is the average blood sugar for the past 3 months. And we have been successfully reducing through our program. The average reduction of A1C is 0.3%. Now, that might not look a lot to you, but 0.3% in reduction of the A1C, that is comparable and even better than any medication, any clinical intervention. The best research we have out there with medication reducing the A1C is about 0.3%. Now, you have to understand that medication costs money and medication have side effects. So now you compare the same results with a strategy, which is a lifestyle change program, which does not involve medication. And if it does so, it's involved just a few medication as a very low dose, meaning that very less side effect and less costly medication. So it's a very win-win situation here. Lifestyle change program. Average weight loss is about 5.7%. Now, the research have shown that a 5% reduction in weight in a pre-diabetes, it's enough to reverse from pre-diabetes to normal. So we have achieved above the minimum requirement to reverse the course of pre-diabetes in most patients. The average minute of activity achieved is 160 minutes. Activities are very important component of the lifestyle change program. Activity have so many benefits, and one of those is to reduce and to reverse certain risk factor for diabetes and heart disease. The required minimum activity level is 150 minutes a week. Well, we have achieved an average, our participant have achieved 165 minutes, which is above the national, the required minimum average. How many people have reversed from pre-diabetes to normal in our program? 76%, a whopping 76%. This is one of the highest figure you can ever find out there for any program. Okay, the good news is type 2 diabetes can be prevented. And so many people do not know this. The National Diabetes Prevention Program, which is a lifestyle change program, uses a method proven to prevent or delay type 2 diabetes. Now, diabetes prevention program, it's based on a research. That's why we call it an evidence base. And according to the research conducted by the National Institute of Health and the CDC, those who participate in this program have seen their risk reduce, their risk from progressing from prediabetes to diabetes reduced by 58% in average. But for those who are 65 and older, that reduction is even higher, up to 71%. Folks, this is more than any medication can claim out there as far as the research is concerned, to my knowledge. In this course, we have few expectations. The Diabetes Prevention Program, Lifestyle Change Program, is, is based on 5 key milestones. The first is the attendance. We expect our participant to attend, and we make all the um, all the necessary um, accommodation to facilitate that. As you know, one of our mission is to address the social determinant of health. We help people with their bus drive, with the transportation, or the amenities, if that can help them to attend the program. Attendance is a very important part. We weight our participants every single week because we want them to keep the eyes on the goal. The goal is to reduce their weight, the initial weight, by at least 5%. And we want this goal to always be in sight so that they don't lose focus. We report, we ask our participants to report their weekly minute of activities. Now that we offer the program remotely, it's even easier because you can sync your Fitbit and to our portal, and every minute of activity will be recorded in the portal. So you don't have to manually log in. For those who do not have the Fitbit, you can always log in. We have a logging um, spreadsheet that you can use. We also encourage our participants to log their meal. We have dietitians that always go through the meals of our participants and identify if they have a balanced meal. We follow the CDC guideline of consuming 25% of the calorie intake should come from proteins, 25% of the calorie intake also should come from um, uh, proteins, another 25% from grains and carb, and 50% from non-starchy vegetable. So we want our participants to always keep their food intake within those proportion balance. Also, we have a big engagement activities in our groups. So it's not just a classroom setting, your regular classroom setting. We have ton of activities. They are fun and they are very engaging, and they keep participants very engaged in the program. What will participants receive from this program? So it's very important. What is there for you as a participant? Well, first, you receive a guidance from a trained lifestyle coach. All our lifestyle coaches are trained on the CDC curriculum, and they are certified. And those are very well versed into knowing exactly how to help you achieve your goal and overcome your challenge to change. One size does not fit all, and everybody have their own challenge, and our coach address those challenges individually. Our the must We also teach you how to master the skills of eating, cooking, and shopping healthy as a part of your routine. We also provide skills and knowledge on how to um, cope with stress and how to build positive outlook on life. It's very comprehensive. It's, we also keep our participant accountable by keeping them, by reminding them to provide their weekly activities, their food log, and tracking their weight. You also have the opportunity to enjoy the support of each other, of other participants in the group who have the same goal. So you learn from other participants as much as well as you learn from the coaches, and you also learn from Dr. Wade, which is me, and You have a full support here. You're not alone. And it's fun. We engage in activity that are offered in the program, such as game, fun exercise break, group discussion, and much more. We organize, in certain instances, some walk in the community. We encourage people to form their group with their neighbor, people sharing the same zip code, and they do activities outside the class. And that has been very, very appreciated by our participants to have the networking group and these new friends and this new support group that share the same goal. It's really become a new family and a new way of life. So our goal here is to help you lose at least 5% of your initial weight. And we have achieved that in more than 76% of our participants, and also to achieve a minimum of 150 minutes of regular physical activity. Now, not all everyone can do the same activities. So we help people to identify what activity is appropriate for them, and we help them also. We collaborate with fitness centers and help our participants to grow and to slowly build the stamina, the strength to achieve those 150 minutes a week. Some people might start with only 10 minutes a day or even 5 minutes a day, but that's okay. We follow our participants, we hold their hands, and we help them step by step, listening to their body, listening to their specific conditions, and we help them through every step of the way until they reach their goal. Remember, this is not a sprint. This is a marathon. This is a year program. It's a 1 year program. We take the time to adjust and to help our participants achieve those goals, milestone after milestone, step after step, and they all achieve it. So as I just said, this is not a sprint. The program lasts for a year, and we meet once a week for 1 hour for 16 weeks, and then once a month for 1 hour for the last 6 months. In total, we meet for a year for a total of 26 sessions. Now it's time for you to ask questions. I hope you enjoyed this presentation, and I'm here to answer any question you might have.
Dr. Wade, as usual, amazing, amazing job. Thank you so much. What a great education for all of us. I'm looking through some of the questions, Dr. Wade, that are coming through. Um, well, I'm seeing a lot of nice comments saying how great and informative this was. But here's one question. One question is about the remote. Um, okay, they're saying that okay, the program is offered remotely, but the question is, how does a person handle weighing themselves since it's remote?
Excellent. So this is a very good question. So we have a platform where uh, participants can log their own weight on this platform. It's a very personalized platform. When someone registered, they are assigned a username and a passwords to access their own portal. The individual portal have many sections. One section is for weight, one section is for food logging, one section is for activity logging, and you have other section for action plans, which are the weekly goal that a participant established. So once you have the platform after registering, uh, the way to log the weight is to go manually and to log in the weight. Also, we have the opportunity, we have the option to have a digital scale that can be synced with the portal, meaning that, and this digital scale has a memory of uh, of knowing that you are the one that is going on the scale. That means that if you weigh 170 or 180 pounds this week, after 2 weeks, if all of a sudden your weight is 150 or 250, the scale will send an alarm, and meaning that probably you didn't lose 20 pounds in 2 weeks, so something like that. And if that's the case, then there's always a way to rectify it. Anyway, uh, so there are two options. You can manually log your weight in the scale, or you can sync the digital scale, and we have it. If you want, if you're interested, we can send it to you once you register. And the digital scale, every time you go on the scale, the signal will be sent to your portal, and it will be synced in your portal, and your weight will be recorded automatically. Am I, is that clear?
I think that's great. That's awesome. So I see something else here about Fitbit. You don't offer the Fitbit. I think I can answer that one. Are you offering
Yes.
the Fitbit?
So we do have Fitbit. Some insurance now. It's important to understand that Medicare and Medicaid in New York, especially Medicaid in New York and Medicare nationwide, is covering the program, and some private insurance, commercial insurance, are covering the program as well. Some insurance include the Fitbit and the scale in their plan for their for for their participants, and some do not. So that is up to your insurance plan. But however, if you are interested in getting the Fitbit, we can give you a link, because we do not make a penny over over those gadgets. But how we collaborate with the manufacturer, you have to give you the lowest price possible if you buy it through the link that we send you. So you buy it at the price of wholesale. So that's to reduce the price. That's if you want to buy it out of pocket in case your insurance does not cover it. But if your insurance plan does cover it, then there's no worry for it. It's all included. And you can sync the Fitbit and the scales with the portal that you will be assigned to. So everything will be digitally recorded into your portal.
That is excellent. So Dr. Wade, it looks like you've answered the next question, because the next question, they mentioned that on one of the slides, I think you indicated people that are 65 and older, that they've received even better results from the program. So the question was, does Medicare pay for it? So you've kind of answered that. So
Yes, yes,
nationwide, and that's not statewide, because as we know, Medicare is a federal program. So Medicare does pay for it. So that's excellent. And then I just see one other question um, with the, okay, looking at this. Okay, HIPAA.
yes,
Is it HIPAA secure? And I mean, we can understand that
yes.
question coming up. So how would you, with the portal and the Fitbit and the scale and go, how does that? Um, I mean, I feel like I know the answer, but I think
Yes.
for the people on the session, could you share with them, HIPAA? Well, for those who don't know, I'll let you talk about it, Dr. Wade. What HIPAA is and what your obligations are as a physician
Yes.
with
So
the
HIPAA stands for Health Information Portability Act. This is a way to make sure that your data, your information are kept secure when you share them with a healthcare provider or with any entity that is involved in your care. And so it's very important that we keep those information very secure, because we require some personalized information such as Medicare or insurance number during the registration process. But having that in mind, the CDC, who is providing oversight of this program, so I want to emphasize that the CDC provide oversight of this program, because the CDC is the one that determines our eligibility to bill insurance by providing us a recognition. So we are fully recognized CDC, Diabetes Prevention Program, and to maintain our certification with the CDC as a fully recognized program, we need to abide by the rules and regulation by the CDC. And one of those rules is to have a HIPAA compliant platform to provide the diabetes prevention program remotely. Therefore, we have no choices, and we are very excited and encouraged by this option as well, for having a platform that is compliant with HIPAA. So the platform we are using, all the platform we are using are HIPAA compliant. And if it's manufacturer or a computer provider, a digital service provider cannot offer us, do not have a HIPAA compliant platform, we cannot use this platform. So all our platform are HIPAA compliant, in conformity with the CDC, Center for Disease Control and Prevention, and the CMS, Center for Medicare and Medicaid.
That is a mouthful, but for those on the call, I'm sure that was extremely clear, and that's really good information, because we see that there are assistant living facilities from around the country that have really expressed an interest in this program, Dr. Wade. So again, knowing that this is HIPAA compliant, Monitor My Health, and you as the medical director, you have to answer to the CDC as well as CMS, just as any other healthcare provider. That this can be reimbursed by Medicare. I'm just doing a little summary. Some insurances will pay for it, and I guess if our HR made a good made a good deal with our benefits, we may even get a Fitbit that'll
Yes.
add. But as you mentioned, um, you have a link. You're not making a profit off of it, but you've made an arrangement with Fitbit to get it at wholesale. That's great. And there's one other thing that I'm seeing as I'm scrolling through. Oh, someone said they like the part about stress. You also, the coaches help with stress, and I would imagine during COVID now, this is a great thing, not just for a Medicare participant, but for any of us who
Yeah.
may be a person that would really benefit from this. This is
Yes.
great. So, did
Yeah.
you have any closing words, Dr. Wade? I don't see any more questions before we close out.
Sure, sure. Thank you very much. Also, I would like to share with our participant, our attendees today, that there's a recent article that was published in the New England Journal of Medicine, which is a very reputable journal, um, that stress the importance of this lifestyle change program in terms of helping, especially older folks, anyone above 40 years old, helping them to prevent uh, COVID, or to prevent eventual complication from COVID if they're infected. So there are two legs here. The first is this program. If you enroll in this program, if you are determined to be at risk according the um, to the screening process, that is validated by the CDC. If you are determined to be at high risk for type 2 diabetes and heart disease, this program not only will help you in reducing your chance, your risk for contracting COVID. In addition, if you do contract it anyway, it can help you from developing the worst complications, which is hospitalization, ICU admission, and death. So this is new this is a new information we have, and that add to the emergency or the importance of uh, being part enrolling in such program in a CDC recognized diabetes prevention program if you are determined to be a high risk. You prevent not only diabetes and heart disease, and now we know also, according to recent research, that you will be well prepared and well equipped to prevent COVID-19 infection or develop complications.
That is excellent. That is excellent. Well,
Thank you.
Dr. Wade, we want to thank you so very much. Um, Again, I'm Vanessa Best from Precision Healthcare. We are thrilled to be working together with you, Dr. Wade, and Monitor My Health. You'll see on the screen how to contact Monitor My Health to really retrieve more information. If you're looking to sign up your facility, if you're in one of those assisted living facilities and you want to know how we can work with the seniors in your facility, if you are calling from one of the employer groups. You want some help for folks on your team that are now working remotely, or if you are an individual, uh, Doctor, something that stood out to me, he said over 40. So if you're over 40 and you're wondering, are you at risk? Or it kind of appears to me that this lifestyle change can help all of us, right? Regardless
Correct.
of where we are in life, to eat better, to exercise more. That's just something real important. So please contact us at 203-243-2244. And then the email is there, admin @monitormyhealth.org. Thank you so much for your participation. Dr. Wade, thank you as usual. And
Thank you
everyone
very
have
much.
a great day. We look forward to seeing you soon.
Yes, thank you very much, Miss Bess.
You are welcome. Have a great day, everyone.
Bye, everyone.
Bye bye.